Hey everyone, it's Dr. Rick, founder of Herbal 411. I'm doing an unboxing on Semax. Semax is a nasal peptide. It's a neurotropic peptide or nootropic peptide. And these things are, the peptides, are useful with certain disease processes. Now, the problem is the animal data is good, the mechanistic data is good, but the human data is lacking. However, it's kind of cool because in the bodybuilding community and the anti-aging community, people have experimented with certain things. I did a video on peptides for increasing healing time. That would be BPC 157, also known as Pentadeca, or TB500. And I think anecdotally, I think the data is fine. I think it's acceptable, low risk. And anecdotally, with my patient, I think it works. So I've also used that, and I now use this. So the idea with increasing or using Semax is to increase BDNF. BDNF stands for brain-derived neurotrophic factor. And there are some prescription medicines, a handful of medicines that increase it, and there's also a lot of medicines that decrease BDNF. The lower your BDNF, the more your brain will go through slower repair. It's very important for, say, people with strokes. Also very important for dementia. Some would say Parkinson's disease. Less intense than that, it would be helpful for sleep, for depression, and memory. So I'm doing this mostly for memory because I have a lot of patients that are in their 50s and 60s, and when I see them, that'll be a complaint. It's difficult to bring up old memories. It's difficult to find the words that they're trying to express. Or the typical guy thing is, or I should say husband thing, you are asked to get something in the other room, you have everything, and then you walk out of the room and it's like, what am I supposed to get? Or you go to the grocery store with a list of 5 things in your brain and you only bring back 1, and then you bring back 4 things that are unnecessary. So just making fun, but it's not just guys, it's also girls. And we as a community are not getting enough sleep. We're totally stressed out, totally imbalanced between too much sympathetic, not enough parasympathetic, meaning high stress and no relaxation or love. So we live in a totally unbalanced society here in America, and that's probably why we die early. But there's areas of the world where they live till 100 years of age, centenarians. It's thought that they have great BDNF, they have great memory. Imagine somebody living until 100 years of age independently, taking care of themselves. I am targeting that. I don't know if that'll happen. I have some setbacks and some personal problems that I'm trying to fix and get past, like all of us. But it's a challenge because once you fix something, then the next decade comes up and age has set in and something else takes its place. But it's always a challenge. And when you have a hack like this, I think it's worth it, as long as it's not too expensive. So I get this from South Lake Compounding. It came in this, and it comes in this. And you're supposed to put it in the fridge. It came with a cool pack as well. But when you get the container, it comes with 2 of these things. It'll last about a month. And the container has 2 little Ziplocs full of this, and actually there's 2. Oh, cool. I have 2, and then I had this extra one. So hopefully this will be enough for about 10 days, 15 days each. Again, it depends on how often you use it, but using 2 sprays a day, theoretically, mechanistically, will increase your BDNF. Now, if you do this and you don't take care of your sleep, come on, you got to fix your sleep. And everybody, I have to do a video on the amount of sleep, measuring your HRV. And I think I've done videos, but still, just for shortcuts, if you do have an issue or a challenge, or say you're getting ready for a big exam, or you're getting ready to plan something that's going to take a lot of effort, like how to retire, or how to take care of your elderly, or what are we going to do with moving, and how do I get these lists all in place? So I would do this at least for a month and then do a little test on your own to see if your awareness, your sleep, your stress level, and your mood and or memory has improved. And sometimes it means somebody else has to chime in and say, no, it's not improved. You're still forgetting stuff, Sagil. So I would consider buying this. The price is not too bad for a 1-month experiment. I think it's less than $100. No, I'm sorry, $200. However, there's people who take, I had one lady who said she started ginkgo. Ginkgo biloba is a great herb, but it also causes bleeding issues. And to get a ginkgo that is worthy and actually where the capsule has what's on the label is really tough, because nutraceuticals aren't held to a great standard. Prescription medicines are, and this comes from a compounding pharmacy, a pharmacy that has to pass the state and the Fed testing. So I think there's more quality here, but obviously more price. The way you use this is you do 2 sprays in each nostril daily, like this. So 2 sprays each nostril. You can probably save money and just do 1 spray each nostril. And again, you're supposed to keep this in the fridge. That's why it came with a refrigerator pack. I've kept this by my vitamins in the morning, and I've kept the bottles in the fridge, but they still seem to work. Now, I used to combine this. I pair this with Semax. Semax is something you use at night. This one has more of an affinity for helping with anxiety. I'll do this in another video. But I've found at this point, especially if I'm trying to pitch pennies, just using the Semax for helping boost my memory the next day would be good. I still have an issue with optimizing my sleep. I have to travel to Indiana to work. I have essentially a full-time job in Indiana, and I have my part-time job with my virtual practice. And I'm taking care of my family, my relatives, the community, and then managing this YouTube channel and my Herbal 411 site. So I'd say there's a lot of stuff I'm doing. I'm 63, but I think I can do things. I'm hoping to get past what I'm seeing all my colleagues do is retire. Now, whether they're retiring because they hate being doctors, getting burned out, or they're super rich and they want to retire, I think that's fair. But just the word doctor, the Latin word, means to teach. If you don't teach, do you lose the aspect and start to shrink your brain? Yes, I do think so. So it's always nice to challenge yourself with tasks, with things to do, with challenges mentally wise. And I think being a doctor, there's a lot of people that need help. And especially with the new generation, or even experimenting with stuff like this, or kind of taking the information you see on podcasters or social influencers and saying yay or nay to those things. I think you have to have an advocate that helps you optimize your health, whether it's just lifestyle changes or nutrition or supplements, nutraceuticals, or prescriptions. I mean, one of the biggest problems in the U.S. is heart attack. Second biggest problem, cancer. And there's ways to avoid those 2 things. The third biggest problem is called iatrogenic. That typically means car accidents or overdosing on prescription medicines or prescription procedures done at the hospital. So that's weird that it's like that is number 3. But to take care of the first 2, you have to go with your procedures and medicines. But if you don't do it properly, then you die of the third thing. So you're screwed. Anyway, you have to have an advocate, and you have to be smart and optimize your health. And no question, you always have to take health into your account first. You have to be the one that leads the healthiest life. And if you're waiting to lead a healthy life until you retire, I've got too many patients that do that. And then by the time they're rich and retire, they're spending all their money on medical disease fixing procedures, or they're seeing specialists. So there's a balance. And certainly money helps buy food and give you other options, but it's not an answer. You really have to invest in proper sleep. You have to be in love with somebody, whether it's a family member, meaning your spouse, or you love your kids, or you love your grandkids, or you love your fellow humans. You have to have that to boost serotonin and oxytocin so that it matches the adrenaline and norepinephrine. So that's well balanced. And if you look at the blue zones and try to live life like these guys, you might make it to 100 without a hitch. But again, a more practical approach would be, what can we do with lifestyle change? Follow your gurus and follow me, perhaps. Or get me. I'm with Herbal 411. If you ever have problems with trying to work the system and figure out, do I really need this surgery? Then come see me. But if you're on your own and you're optimized already, I don't think it'll hurt by trying this experiment. Again, a month to 2 months of this, and then no other changes, but see if it helps. If it does help, then great. Put your comments down below if you've tried this already or anything like it. You also have to be careful about where you buy your compounded peptides, because there are some places that say that they compound peptides and they are sketchy. And if done the wrong way, you could be putting in a lot of crap. LPS is an issue, especially with injectables, lipopolysaccharide, and sometimes the cheaper compounding pharmacies don't filter for that, or they make it cheaply, and then you're actually causing worse problems. So please be careful about what you do. Please be optimized with your health and consider fixing a couple of things a shortcut, but also making sure that you're taking care of things with a long cut. Hopefully this gives you a couple of ideas. If you have any comments, put them down below. Consider subscribing to my YouTube channel and or seeing me as a patient if you want. Otherwise, I'll check you out the next video.